pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Apologize for being a little bit off. Isabel thought she was gonna chase the squirrels outside instead of coming to the meeting.
It was the fresh, cold air.
Yeah, it's gotta be
It's
that.
going.
Which is why she got the buzzer.
Ooh.
Buzz, not shock. So we're gonna do resolutions first. I was gonna switch it around a little bit and have Eric talk, but Phil has some pressing matters that somebody unplugged the computer system and he's taking care of it. Okay?
Here comes
I
Kevin.
need, yep, so I need a motion, second,
Second.
all in favor,
Aye.
opposed, motion carries. You're up there, chief.
HE1 is a resolution appointing a new member to the Board of Health. Kristen M. Nyland has been a doctor of dentistry since 2006. She is well known within the community for her advocacy and for her volunteerism. If she is approved, she will be replacing Dr. William Buckley, which is also a dentist that resigned from the board September 1st.
So, have a motion?
So moved.
Second.
Second. Any discussion?
I know Kristen personally,
Okay.
Carl Nyland, their dad,
Oh, really? All right.
planning board.
Smile.
Huh?
Let's see.
She's not my dentist, but I knew her since I taught her in Sunday school when she was 2 and 3 years old. So it's been a number of years knowing her.
Good. I will tell you, as vice chair of the Board of Health, the one thing we can be proud of in this county, we have a vet that's on there, we have doctors, we have dentists, we have me. I know how to open an aspirin bottle. So it's a good mix, so the conversation is very rounded, when we're reviewing things, and, I think it's a great recommendation. Nothing else? All in favor?
Aye.
Opposed? Motion carries. You're up again?
AG2 is a resolution authorizing a budgetary modification for the cost of aerial spraying to control disease-carrying mosquitoes. The spraying was conducted on September 21st after the state declared an imminent threat to public health. We request that we increase the environmental funds of $38,179. This money will be offset by unused funds out of the preschool budget, and we also receive Article 6 reimbursement.
Need a motion?
So moved.
Yep. Second.
So, we've covered this before, I don't know if everybody remembers, the reason why we don't put the spraying in the budget is if we put it in the budget, we pay the whole bill. If we get the state to declare a state of emergency, they pay half, and we pay half. So, we do this every year because it saves us half of the cost by getting that declaration of emergency put in place before we actually take any action. Is there any other discussion? Go ahead.
And another reason is, we don't necessarily spray every year, so we don't wanna put it in the budget and raise it on the tax levy when it's not necessary.
We didn't think it was gonna happen this year.
We went quite a ways into it before
We
we
did.
pulled the trigger on that one,
We did.
metaphorically speaking. Any other discussion? All in favor?
Aye.
Opposed? Once again,
AG3 is a resolution authorizing a budget modification to increase the funds to early intervention, other fees and services due to an increase in service units to providers. This has been trending $50,000 higher this year, higher than the last 2 years. The cost is eligible for 59% reimbursement, 49% reimbursement. The remainder of the offset will be used from extra funds that was in the preschool division. There'll be no change to local share.
Need a motion?
So moved.
Second.
Second. Any discussion?
Yeah, what's driving this? Why is it up?
This is, so we looked into that, why. So it really does not have to do with the number of children receiving services, but it has to do with the number of service units provided. So a service unit could be 2 service units, as if it's physical therapist, if it's speech therapist, if it's, so children are getting multiple disciplines coming in, which increases the service units, and the amount of time that the provider spends with the child and the family increases service units.
So it's not, like you said, not the number of
No.
children, it's the
Amount of
more
work.
extensive to
Yes.
what each child gets.
That's correct,
That's where it comes from, okay.
that's correct.
Any other discussion? So, you're aware of this, you go to NISAC, this is something we've argued in NISAC every single year. I sit on the committee of children with special needs. It seems to fall on deaf ears on the state level, but, the funding is just not keeping up with the needs in the community, so, we gotta take care of, them peeps. Any other discussion? All in favor?
Aye.
Opposed? Motion carries.
HE4 is a resolution authorizing, a request for authorization for a budget mod to reallocate unused funds that was in the hospice division to purchase needed supplies and equipment. Our AV equipment in our training room is really hit or miss. Sometimes it works, sometimes it doesn't. We hold very important meetings in the training room, and we have had to go from a virtual meeting to trying to have people call in, even on cell phones. The screen in the administrative conference room is broke, and we've tried to fix it, and replacement parts, because this is obsolete, they don't make them anymore. And it's in the position, and it has to stay in that position because we need it. We also need a new desktop and a couple monitors that need to be replaced. Exterior signage, we worked with B&G for a quote, so we can have a more appropriate sign. This is the one that is currently up. This is what we would like it to look like. I also worked with Sarah Sunday to make sure, because part of the sign does say New York Connects, but since we are the main entrance, I did call her to see if that sign needs to be in the main entrance, which it does not. Everyone that uses New York Connects uses the Office of the Aging,
Right.
so that sign will be relocated to the other side of the building. And I did work with Brian with the Youth Bureau to make sure that he liked the new design also. Also, we'd like to use some of the funding for tabling events. We'd like to purchase banners and tablecloths that kind of all match and are consistent with the image that we are trying to set forth through the whole health department.
Need a motion?
So
So,
moved.
second.
So, part of this is this whole movement, for us to grow and become certified,
Accredited,
accredited.
it is.
Thank you. And it's the right image, and it's the right thing that we need to do. That conference room is used a great deal, not only by the health department, by other agencies that need to be over there and involved, okay? So, any questions, comments?
It sounds like a good usage of the monies within that department to make things a lot clearer. People don't have to ask questions or go in the wrong door and everything. Now with the hospice division being closed down, is this the completed end of hospice?
This
Last month or two, we moved the last position from there into administration.
That's correct.
And so this is just the unintended
Hospice is
funds.
completely closed, and we
Hospice is
have,
done.
we've turned in our certificate.
that
And in
one-
the minutes, it said that there's, the other meeting, there's one bereavement case that should be,
That's It's already
No.
been discharged,
That's done now,
yes.
Done.
okay.
Yeah, that's not in the
We're
budget line for
completed.
next year.
That's
Right.
correct.
Is this the last of the funds though that are in hospice?
No, there's still
No,
more
there's still
funds.
some remaining.
What's gonna happen to that? If that
Yeah.
doesn't go to Phil, does it?
Well, it probably wouldn't hurt for it to go back into the general
I
fund.
would assume that it would
Go
go to
back
the
to the
general
general
fund,
fund.
but that's a Phil question.
After having walked through that
You got
yesterday,
another month. Come up with something.
after having walked through that yesterday, that little bit of money going back in the general fund.
I know, but still. Done a good job with the budget this year, might as well see what you can do with it.
Okay. We'll definitely have a look at it, thank you.
Okay. Other discussion, all in favor?
Aye.
Opposed?
Thank you.
We're gonna put Eric up next, because I know he's a busy guy. You're welcome.
Good morning, everyone. Hi, I'm Eric Brady, the Executive Director at Farming Family Services. This is Candy Herbert, she's our Operations Director and my partner in attempting to execute this capital project. Got some renderings here, just to give you guys a sense of kind of what we're looking at. And they're, conceptual drawings, and these are pretty small, but at least gives you the big overview. And Jim, I can get you these in PDF too, especially for you, it would be helpful to be able to blow anything up on
Yeah.
the screen. So, currently, Farnham
Excuse me a
is
second.
Farnham is a nonprofit health and human services organization, serving Oswego County, primarily focused on the prevention and treatment of substance use disorders. So we currently have 3 primary locations in Oswego County. One in Oswego at 283 West Second Street over by Bashaw's. One in Fulton, kind of across the 41 from where Q Community College is. It's right in next to Liberty Resources. We're in a building with them. And then we have one in Mexico on Hamilton Street. We just opened a clinic in Auburn, kind of near where the Holiday Inn is in Auburn for opioid treatment programming.
Is that the Oswego farm opened up over there?
We did,
Okay.
yeah, we just expanded into Cuba County. That was a couple years ago. They reached out because we specialize in opioid treatment, to see if we could just start a clinic up there. So it was kind of a long process to, we wanted to make sure we were building the community relationships and not just kind of bulldozing our way into somebody else's kind of territory. So we took a little time to do that, get some funding, but that just opened in August, it was.
Okay, it was rough.
Yeah, there's a lot of need, it's very similar, the Cuyahoga County and Oswego County needs aren't too different in terms of like rural poverty and,
Right.
and substance use, so anyway, there was a big need there and it's already helping a lot of folks. And then we have a small administrative office in the old St. John's Rectory over on Erie Street. So kind of what happened with Farnham, was we just saw an explosion of the number of people that were coming in to get treatment, especially in Oswego. So when I came in 2015, at the end of 2015, our census was, in Oswego was about 150 folks. We're currently serving upwards of 400 in that same space. And so we did, like the way the building over there is set up, we were kind of in half of it, and the other half was mostly vacant, so we kind of spread it over to there. Then we kicked out all the administrators over to Erie Street to make room for the direct services, but we're just out of space. And anybody that's been in that neighborhood, especially in the mornings when, treatment's at its busiest, it's very busy, and there's a lot going on, and it's just very cramped. So we need a new location, we need a space that, serves people with privacy and dignity, but is also very accessible. So we work with the City of Oswego County Council, thank you, Kevin, for your support through that process, to identify, what would be a good place that kind of met that criteria, but also aligned with what the city was looking to do with their planning. And so we identified the property on George Street, in between Empower and the Connects Care Health Center. So that property actually came up for bid. We partnered with Galloway to submit a bid to have this project there. That ultimately got approved by the Common Council. We went out to New York State Office of Addiction Services and Supports and got them to fully fund the project. So it's gonna be probably around a $10 million investment, fully paid for by Oasis. and with the capacity to serve up to 500 individuals at a time, so we'll have a little bit of room for growth out there. We'll be able to bring the administration and the treatment programs back together, which is nice because it's just a higher level of support for all the direct service staff that are out there versus being a block and a half away. And hopefully just have a nice place where people can get treatment services with dignity. So the timeline is, this is a construction project, so these things move, but the tentative timeline is to get bids this spring, to begin construction this coming summer, and then to hopefully complete construction by November 2025. So we wanted to get out and just kind of make sure people are aware of what's going on, get any feedback or questions that there are from the community, so that we can kind of be out in front of that, we're building that and incorporating it into our plans, as it makes sense. And so I'd run into Jim and he said, please come and present to the health committee, and that'd be a great place to start, so here I am.
So there's not an ask, it's an informational, because this conversation moves forward, and we just, did allocations in human services yesterday, which involves some opioid money. And Farnham is a recipient, I think, of 2 grants on that one.
We
Don't make
applied
anything
for
of it,
two.
yeah,
We applied for two. That's right.
it made it through committee, it's gotta
Yeah,
go
it
through,
did.
it's gotta go through that floor.
Fair enough, understood.
But you'll be all right, I mean, we all understand that, we've discussed this on this committee before. So if you have any questions, feel free to push them a little bit, find out what you wanna know. Go ahead.
Eric, correct?
Yes, sir.
Does, Farnham offer inpatient or is it all outpatient?
It's all outpatient currently.
All right,
So what we tend to do, just to give you a quick, should I answer the question, but, so what we tend to do is we partner with other organizations, especially like Helio Health out of Onondaga County, to get people connected to inpatient treatment as needed. We have a lot of folks that come in for an assessment, they qualify or need that level of care, and then we connect them with peers, in order to get down to Syracuse to get that, level of care and to access that. And then usually what happens is when they're released from that inpatient stay, they tend to come back to the outpatient treatment at Farnham.
now Helio Health, is that the one down by the hospital down there
In Syracuse, yeah, I think they're, what is that?
by East Adams?
I couldn't tell you exactly, they're right by like the 81 bridge, like you can, when you're going by, yeah, I mean, you can see their building, anyway, they're in Syracuse.
It's
There's a
fairly new,
couple in
right?
Syracuse, yeah, they got a fairly new building.
Yeah, I think that's
Carlson's
East
down
Adams
there,
Street.
Helio, yeah.
Well, I could sit there and talk to you all day long about this, because I say fortunately, because the person did recover, but, I had a lot of, experience with, Conifer Park,
Okay.
and it's a fabulous program.
Yeah.
And I'll tell you right now, it doesn't matter where you are,
Yeah,
it's the same issues across this whole country, for God's sake, let's be real.
yes,
And, you've got my full support to go move forward with everything you need, because, it's a big problem. And it affects, and I've sat on every one of these committees in my career here so far. Jeez, can you imagine career? But, people do not understand, a lot of people,
yeah,
unless they're involved in it or been in it,
yeah,
how addiction influences every single one of basically every one of our departments. It does, just does,
it does.
and it's a real issue.
It's very prevalent, it's, if you've ever had the good fortune to not be touched, by someone in your life, right, then, a lot of folks just, they don't understand, like, how it can really impact a family system and individuals. And part of our problem, in treating this thing is, it's so individual and it's so different for each person.
Oh, yeah.
That you really gotta individualize the services, you gotta have good access to the different levels of care, in order to kinda meet them where they're at, and you gotta be ready when people are ready. So if somebody comes and says, hey, I'm ready to get help today, you gotta be ready to get them the help that day, because tomorrow, who knows, they're back into the throes of the addiction. So I appreciate the support, and Happy to chat, outside of this meeting as well, but, also, we do also partner with the park, another resource for us.
Fabulous program.
Absolutely, yeah. They do really good opioid treatment there as well.
You're familiar with Eric? Thank you.
I'm gonna give a personal example of a person who has gone through your program as my neighbor. He got an addiction problem as a result of a construction accident and just went downhill after that, all the way, right to the point of a couple years, and ended up in state prison.
Wow,
Spent his time in there, in a shock camp, came out of there, came back home right next door. His parents live in the next house, and you're right, it affects families, it affects neighborhoods.
yeah,
He came home, and I would see him get up every morning, and his dad would say he's going to his treatments every day, and he's gone every day. That young man is back to work.
no, great,
We are thankful, I'm thankful for him and his family, because it means a great deal. You do an incredible job.
Thank you.
Incredible. I see it firsthand. I see that young man, and I'm thankful for what's happened in his life and for what you're gonna do in many people's lives.
thank you.
Very much needed. You do a wonderful job.
Yeah, neither side of that story is unusual. I mean, there's a lot of folks that, some injury, they start on taking their doctor's orders,
Mhm.
for the opioids,
Yep.
and then they're hooked. And then they
Yep.
can't get access to them because of the laws that restrict access, so then they're turned into street, illegal options, and then it's a spiral, like this gentleman. And also, a lot of folks make it back, they get that intervention, they get the right medication, the right supports in their life, and then they get their family back, they get their jobs back, that, things start to stabilize.
I see it firsthand. It's right next door to me,
Thank you.
right just next door. For a period of 2 years, you could wake up different times and see the house completely surrounded by police from Madison County, Onondaga County. The Indian reservation came up. It was and people want those drugs. They'll go to any extent
Sure.
because they don't realize what they're doing and the harm they're
Yeah.
causing.
Yeah, I often say like that an individual that you would never think would steal from their grandmother, steals from their grandmother, right? And that's the addicted brain, because there is one priority and one priority only,
Yes.
and that's to get the fix.
Thank you, though.
Yeah, thank you, thanks for sharing that.
Do you have a comment?
I just have a question. The funding that, you're saying this is gonna treat up to 500 clients?
Yes, I added, that's the daily census, yes,
Now, are they all Oswego County folks
Yes.
usually?
yes. And that's primarily, now remember, we got 3 locations, and
Right.
so our Oswego County census right now is 750. So we got, 450 here in Oswego, we got another, 150 in Fulton, and another 150 in Mexico.
So how will that work for Cuba County? Will any of those come up too if they
No,
need to?
that's pretty separate. I mean,
Pretty
those folks, people wanna be close and accessible, especially like your neighbor. I mean, someone that's getting, starting out on methadone treatment, they're often going daily, 4, 5, 6 days a week, because they're seeing the medical team, they're getting evaluated by nurses, they're seeing the doctor, they have their counselor, they're going to the group sessions, they're seeing their peers, so it's an intensive, it's outpatient, but it's an intensive level of support. And so those folks, like when we I'll start with Oswego. When we got open in Oswego, the first people that came, the opioid treatment program, when that first opened in Oswego, the first people that came were folks that were currently traveling 45 to 60 minutes each way daily to access their treatment. Now it's available in their backyard. So now they can expand their availability for work, they've got more time with their families, they're able to kind of focus on other things in their life that they need to be able to focus on. The second wave of folks that we saw come in were folks that were previously doing well in treatment, usually in Syracuse, were unable to get there, for whatever reason, didn't have the time, didn't have the transportation. Once it was available in the backyard, they started accessing it again, and they were starting to get healthy again. And then we started seeing the wave of folks come in who had never been successful, with treatment, starting to get successful. And then it was like this word of mouth, because, you've got your circles, and so you're using with groups of people, and those groups would start to see their peers getting healthy, like, what are you doing? How are you doing that? Because most folks, when they're at this part of their addiction, they do not want to be there, right? They're like wanting to get out, but finding it impossible. And so then we kinda got the word of mouth referrals. So that's the same thing that's happening in Auburn. A lot of folks that are currently, you know, traveling to Syracuse or traveling to Ithaca on a daily basis to access this treatment are now accessing it in Auburn. So those folks aren't gonna come, you know, to Oswego because it's too
So-
inconvenient.
Will you close those other outlying spots, or do you keep them open so that people don't have to travel?
We keep them open for access, as long as there's enough level of need,
Right.
you know, to
No reason
keep
to
the
shut 'em
doors
down.
open, there's no reason to shut them down.
Yeah.
They can support themselves,
Good. Yeah, go.
I came in late, so if you already answered this, I'm just,
No worries.
how are you, by the way?
Yeah.
Just a, might sound like a simple, naive question, but let's assume we've got these people walking around Oswego, right?
Yeah.
Obviously, they all have an addiction, that's why they're there. They don't have a home, they don't have insurance, they don't have jobs. What's being done for them? I guess
Yeah.
that's really what I'm getting at.
Yeah, there's a couple things, and this can always be better, alright, so part of the challenge with the folks that you see underneath the bridges on the Riverwalk in Oswego, is they've been let down a lot, they got mental health conditions, they don't trust the system, so even if you're, you know, very well-meaning individual who goes up to them and says, hey, I could get you some help, come with me, no, you know, they don't trust you, they don't wanna leave what they have available to them, as little as it is, because they're worried about losing that as well. They're worried about being able to successfully jump through all the red tape and hoops, so you've kinda got that barrier. That being said, and we've actually got a new initiative that we're getting ready to launch this fall in partnership with Oswego County Opportunities and the Street Outreach Team, where we're embedding a substance use peer, right, so you have an addiction professional going out with this team to try to engage folks, and the basic strategy is you keep showing up, you give them you know, a care packet that maybe has some food or some supplies or different things they need to attend to their kind of health conditions, so you get some little base hits with them, you keep showing up, over a little bit of time, you can hopefully establish some trust, and then they'll go with you to that appointment, to that referral, to DSS, to connect to housing, to connect to insurance, because there are programs, there's a network out there, you know, you talk about all of our county departments, there is a network out there to help people if we can get them successfully engaged. So one of the things though about this building project in particular that's exciting, and I know it's small, but on the third page, you see the waiting room here, and then you kind of see these white spaces right behind the waiting room. Those are spaces that are gonna be delineated for recovery support activities. 'Cause one of the things that we're unable to do in our current site is engage people between appointments and when they're waiting for the Medicaid caps. Sometimes the Medicaid caps can be an hour and a half wait, and we want people to be engaged and productive during that time versus, you know, bothering John Bashaw when he's trying to do an assessment on a vehicle outside of a shop. So we have recovery spaces and we're developing programming for recovery support activities to be able to keep people in the building and engaged. So there'd be computer monitors, would be kind of like a little bit of a lounge area where people can have a cup of coffee, talk to a peer, chat, they can connect with their Department of Social Services workers if they need to. There's some one-off meeting rooms built in, so we're trying to design the space that also helps to get at that solution of engaging people, and engagement's a trust game, and so sometimes it takes a little bit.
Would it be possible to get a different view of this, like online or something, so we could expand this to read
Yeah.
all this little
Let
writing
me,
in here?
yeah, let me send this, Jim, if I send it to you, can you get it to these guys?
Yeah,
Let me send you guys the PDFs, because then you can zoom in.
Exactly.
Yeah, I'll do that.
Thank you.
When I get back later today. Happy to.
Does everybody know where this is gonna be? Familiar with George Street?
Yep.
Yep.
Right in between Empower and Connect Care Health Center.
If you get totally lost, come up around Ollie's, come into a Rise, get a cup of coffee, calm down, and I'll show you where it's at.
And that's one of the nice things, like Arise is there, Connect Care is currently there, and I know they got some different plans. But at the end of the day, that reverts to being an Oswego County Opportunities building, right? So you get a little bit of, you know, value out of close connection to other services.
As a point of reference, I haven't had a chance to tell you this, but Arise now has a contract for Medicaid enrollment for
So it's like the
For the next 5
navigation type
years.
stuff? Okay, I didn't know that.
And I'm an enroller,
Well, we'll
and
have
that
to
is not
check.
exciting.
We'll have to check. It's needed though.
Yes,
Big
it
time.
is, it is.
Yeah.
Go ahead.
And maybe I'm just missing this, but a question that I have for you. Excuse me, and you hit on it. That's why our bridges are full of people underneath them, unfortunately.
Yeah.
Do you have a direct tie, not you personally, but the organization have a direct tie with Oswego Health?
Oh, yeah. Oh,
Because a lot of this is, you know, problem, people have
yeah.
mental problems
Yeah.
for a lot of different reasons.
One of the things that I think we can probably be most proud about in Oswego County is the level of collaboration that happens between the county health departments, between all the independent nonprofit health and human services organizations. And it's at every level, you know, so, Val Favada sits on my board, who's an administrator, at the hospital, she sits on the farm board. That's like at the top level. Programmatically, we're collaborating everywhere we can. Some things go better than others, like we'd like to have our peers, like, better connected to the emergency room. That comes and goes, because there's a lot of kind of rotation in terms of the docs through there, and so like keeping that consistent is a little bit of tough. But connection with, what are we calling the inpatient center now, Lobdell? The Lobdell, Lakeview, Community Health Center. Great referral connections there, back and forth, people coming out of there to Farnham, people from Farnham going there. Other care, like primary care, we work with, Connects Care, we work with Oswego Health, as primary referral sources, for that. So there's a lot of, referral and connection service that happens between the organizations. Was there something specific about Oswego Health, or just generally, you're wondering?
No,
Yeah.
nothing bad about it. My biggest concern is, probably out of all these guys, I live the furthest away, cause I'm 3 minutes or 4 minutes from Route 31.
Okay.
So all my primary everything's in
Yeah,
the city,
yeah.
so,
Yeah.
and as close as it is, it's far away from our services here.
Yeah,
And I do have a concern, and I always will have a concern, because, it's a big county and it's gorgeous and all that kind of good stuff.
yeah,
But you get up to Redfield and up in that area, Boylston, there's nothing up there. And that's a long ways to reach those people.
yeah,
And they do have a high rate of addiction up there.
absolutely.
And I wish I knew what the answer was. No, we can't afford to build a $50 million building up there. That's not gonna happen.
That's one of the reasons so Harbor Lights was in Mexico
Mexico.
for 30, Stan and Ann Long, served that community for a long time, and when they were getting ready to retire, unfortunately, their original plan was, their son Andy was gonna take over the business, and he tragically died of cancer a few years
Yeah.
before, they had the opportunity to do that. So when they were getting ready to close down, they reached out to us and said, we don't wanna leave this vacuum, cause that's as close as it gets for folks, up in Redfield,
Right,
in
right.
that area. And would you keep it going? And so we kinda moved in, kept it going, started doing the opioid treatment, the peer services, the vocational services, so we expanded things, in order to keep that access point open, cause it's a little easier. It's still tough, and then the other thing we run into in those rural communities are people are very private, and so, like, breaking through, that trust, component, that there's really someone here that has your interest in mind, and we wanna help you, that's tough in those communities.
Well, that's where we have to really build
Yeah.
a strong collaboration and a network
Yeah,
reaching out to, doesn't have, it can't be an elected official. It has to be somebody that people trust up there.
yeah,
And it could be the best drug dealer up there, I don't know, but it's gotta be somebody that they trust.
yeah.
And I understand that, because people live in those areas, and believe me, I lived up in Parish for a number of years. You wanna live isolated, that's where you live.
There you do it, yeah. And that's an opportunity for that outreach project too, right? That's not only gonna be on the Riverwalk in Oswego, we're gonna be reaching out to Redfield, and you connect with the fire departments, you connect with the EMTs up in that area, people that kind of, the legions, you know, the rural kind of network that's available to try to establish the trust and the presence. Thanks.
Mark?
Yeah, just one more question about all the agencies
Yeah.
that are involved in this, right? And I know, and it might not even be the right question for you, but I imagine it's the Goliath in our county for this. You would probably have some sort of opinion on it. But there's a multitude of government agencies, private companies, and not an inordinate amount of nonprofits, right? That go out there, everybody wants to pick up a cause and they wanna do the right thing. Is there anybody coordinating all this? I mean, is there anybody seeing what one nonprofit's doing as opposed to another nonprofit, and they're both looking for government funding to support these operations? I mean, is there some sort of oversight at all of who's doing what, where, and how these
Yeah.
coordinate? I guess that's my question.
Yeah, for the most part, that happens through county mental hygiene. So
Okay.
Nicole Combsy's shop and the integrated subcommittee, so the community services board and the integrated subcommittee, all the providers basically report into that group. Nicole manages a lot of the regulatory, you know,
She's
green lighting.
fantastic, yeah.
She is fantastic for these programs. So like if you wanna start a state program that's regulated under developmental disabilities, mental health, or addiction, you gotta get through Nicole first. She's got her and Kathy and their team, they got their eyes on, you know, everything that's going on. And if you wanna do something like that, you better be showing up to their integrated subcommittee meetings and keeping them kinda informed. So that's, I'd say, the most formal kind of part of the oversight that happens to kinda control that. And again, just in this county organically, and you don't get this down in Onondaga County, there's just natural collaboration. There historically hasn't been a ton of, you know, competition, and so like we've all had to come together in order to make this thing work and try to serve people and meet the needs, so.
Thank you. Jim, I believe you're on that board, correct?
Yes.
Yeah.
Huh? Is there any board I'm not on?
Yeah, when are you gonna be enrolling people for Medicaid? You ain't got time for that.
Did my first application, sent it in, we'll see what happens. Got my fingers crossed, they'll say no, don't ever let him do it again.
Good luck with that.
Yeah.
Well, I'm
Any
happy
other
to come
questions?
back, yeah, anytime, you know, if you guys want updates.
But I thought it was important that you at least have an opportunity to explain the program, because once you start doing the structure and people have questions, I realize it's a small group, but, you know, we all talk to the other legislators and that, and I thought that was important that you come in and at least had an overview. You know, we walk away with something, we have an idea
Yeah.
where you're headed as an agency in that, so.
I appreciate that, and I'd prefer to have you guys knowing in advance, so if you start to get the questions from the community,
Right.
you can say, I know the guy to call, I know a little bit about that, and I know the guy to call.
Right.
And so I'll make sure when I send those PDFs, my contact information's in there, and, you know, feel free to reach out.
Okay.
Thank you.
Very
Thanks
good.
for the time.
Thank you very much.
Appreciate it.
You're back up again.
Okay. So, for strategic planning, we're continuing to meet weekly. For our readiness assessment, I wanted to share the new public health brochure, and it does give highlights to the services we provide here at the health department. I'll just pass them all around. So public health is the science to protect and improve the health of people and their community. It's important that I give the definition for accreditation. We work to achieve this by promoting healthy lifestyles, researching disease and injury prevention, as well as responding to infectious disease outbreaks. These are printed on really nice paper, but I did the cheap version to hand out to you guys so you could see.
We're special.
And if you would like any of these for your agencies where you work or pass out to your constituents, I'd be more than happy to make sure you have a bunch of them.
And I have a place I can get these distributed
Wonderful.
from.
I will make you some copies. Our public health educators, fall's been a very busy time for health ed activities, including tabling events, smoothie bikes, school presentations, on hand washing, which is our Scrubby Bear presentation, vaping, and we've been doing a lot of mental and emotional health. We continue to make plans for our Public Health Week, adding now the solar eclipse that will be the following Monday after Public Health Week. We are finishing up our diabetic self-management program, and we're starting a new chronic disease self-management program in November. I'm also having staff attend a training, which is a new training for pain self-management. Our emergency preparedness, we completed and updated the pandemic flu plan, which includes a very extensive public health emergency preparedness survey that we completed and submitted to the state. Our OD2A, a lot of individuals have reached out for one-on-one Narcan training. Also, we conducted a Narcan training for the SUNY SCTEP, which is the Collegiate Science and Technology Entry Program. We continue to work on our public health and safety team and our overdose response fatality review team. In October so far, we had 20 overdoses, 0 fatalities, and 3 Narcan saves. Year to date, we've had 287 overdoses. This is the data from the EMS data record. So this is the most complete record of data that we have. It's not a full picture yet. We're still working on that. We will get it eventually. That's what our public health and safety team is doing. We're trying to get all of that data so we don't duplicate the ones, so we're not getting a false reading there, and we want to make sure that we're getting all the data. So fatality or an overdose that happens at the hospital or comes into the hospital. So we're working on it. We will eventually get a full picture. I do have information. You're welcome. And I did print out a copy if anybody wants a copy of this, and it just goes a little more into detail about our overdoses and that program. Environmental Super Dirt Week ran first week in October. It was very successful. Food inspections were done on the 4th and 5th, and re-inspections, we did have to go out and re-inspect one facility on the 6th. The mass gathering and campground inspections were completed on the 4th. We had no violations found at the mass gathering. We did have one illegal campground that was found and fined for issuing a campground without a permit. Any questions on that? It was outside of the mass gathering on a side road.
I think I know where that was.
You probably did.
My tour this year went very well.
Awesome.
I only found a couple little things that I'm gonna do with them. It doesn't involve
Help.
health related,
Okay.
involved a couple other little small issues.
Okay. All right, very good.
Where was the illegal campground?
It was across from the legal campground, and there was advertisement and, yeah.
Oh, was that on the corner of,
We don't identify.
Right, okay, thank you. I was like, I don't know how much information I can give. I can give you the whole report
did
if
they
you
have
want.
pool access across the street?
Yeah, it was in walking distance. So that becomes an issue because Super Dirt Week, they pay a lot of money to have a regulated campground,
Right.
and then you can't have illegal campgrounds. Several fall events were held and inspected by our department through September and October. We did Pumpkin Fest, Central Square Apple Fest, the Fulton Fall Festival, Locktoberfest, and then in addition, we did have an increased number in temporary and mobile vendors during salmon season. Our last rabies clinic for the season was held October 11th at Scriba Highway. We vaccinated 142 dogs, 55 cats, for a total of 197. Year totals for vaccines given was 1,424. We vaccinated 1,105 dogs, 313 cats, and 6 ferrets for the year. So far, we've had 73 animals tested for rabies, only 8 positives, which is 3 raccoons, 2 foxes, 2 skunks, and 1 bat. I do have a report on more detailed environmental work that we've been doing. If anybody wants a copy of that, please feel free to take it. Another exciting thing is after 28 counties in New York State lacked real-time coverage for smoke days during the past summer's wildfires, Cornell researcher that is leading an initiative to install air quality sensors reached out to us along with NISAC
It's killing me.
and asked if we wanted to be the holder of an air quality sensor. We said yes, so in a few months, we'll be getting an air quality sensor to, put up right at the health department, and we'll be doing the monitoring, so that's kind of cool.
You only need to get one,
Hmm?
you're only getting one.
We only got one. Every county, they want every county to have one sensor
Fires out now?
to go on a municipal building. Some of the counties, Cornell, Cooperative Extension took the lead on it.
It's not a mask.
Some counties, the Cornell system did not want to take the lead on it, so the health departments were asked if they wanted to, and of course, we did.
No, we don't have, is there any criteria where you would be asked to strategically place this?
It seemed pretty simple for the instructions I did get. We haven't received it yet. It takes about 2 hours to have it set up, and you can put it right on the side of our building or on a, the answer is no. It seems pretty simple. So more information as I get it, when we get the equipment. It seems really pretty simple. The criteria was like, you needed a secure location, which the health department is. We have cameras located there. And, you needed Wi-Fi access, which we have also at the health department.
No, because of the geography of this county is so different. I mean,
Right.
you know, you're putting it basically in one of our most populated areas. Now, is that gonna, you know, what kind of a reading are we gonna talk about, or is the state looking for as far as the air quality in the county? It's a good question, isn't it?
Yes, I guess we're gonna
I
learn
think
a lot
it-
from the air quality. I think that's the reason why they wanna do the testing is,
And I think it's also a little bit to do with population. They
I
don't
think the
want it,
denser it is, the
they
better.
don't want it out in the country, they want it near
they asked it for it to be at a municipal building
it's
if
gotta-
it wasn't
it's
at
gotta
a
be
Cornell
someplace where
site.
there's people, and they can make that determination whether they're being effective or not.
I mean, let's face it, the air quality up in San Bernardino Falls is gonna be a hell of a lot different than will be in downtown Bolton.
Don't disagree with you, we,
Right.
but
Right,
They're
they're only giving us one
give them
sensor.
one, let's
And
take
it's
one.
free.
Yeah, I know.
That's
That's
how I
Ask
look
for
at
another
it.
one.
Right,
Gosh.
so,
That's a great
Cause
point.
that's
I
not a
hear
true
you.
picture.
Don't disagree with you.
Right, because does the DEC have anything to do with that?
they do not. The project is funded by the Cornell Atkins Center for Sustainability and is a partner between CCE and the Cornell Department of Health and Ecosystem Health.
Yeah, I was gonna say it's more environmental than anything.
Most Cornell Cooperative Extensions are doing the monitoring. If the county had a Cornell Cooperative Extension that either couldn't do the monitoring for whatever reason, they went to the health departments to ask if we could set it up at our site. And the answer is absolutely.
Mm-hmm.
Yeah, the more information we get, the better.
Good puzzle.
Well, it's not a true picture.
Well, right, it'll
mean,
give
let's-
us for that location.
I was gonna say, because if you look at the density of traffic that's in that particular area within, we'll say several hundred yards, you got
Right.
481 right there.
Right?
Now, the air quality along 481 would be a hell of a lot different than it is if it's up in
Absolutely.
Right.
Plascon. you know,
Right,
away
and we
from
have the nuclear power plant, and depends on when the wind blows and, it'll be
that's
interesting.
all I'm saying, I don't
Right.
know what, you know, it's almost like it's a waste of money to me. Not your,
it's not our money.
It is our money, what the hell do you think's paying for that?
It's Cornell, it's,
Yeah, but
It's
we're paying
air-
for that.
I think the university, which might still be taxpayers' money, I'm not sure.
I'm sure.
They're,
I'm
they're
sure it's
not,
funded by some
Yeah,
sort
sure
of
it's-
government funding.
they're a private university,
Right.
so.
It's
Okay.
our money somewhere.
Cornell is a private university.
Okay,
They still get government funding.
Yeah, they still go after.
Oh,
grants.
yeah.
Well, I
Oh,
didn't say
yeah.
they didn't, but it's not,
Right, right.
I thought it was kind of a
they're
neat
funded
thing.
through
I
their
didn't wanna
vet-
say no and be labeled as one of the counties that didn't do the air quality testing.
It's probably funded through that veterinarian hospital they have, because when she bid a bee, it was a $5,000 bill.
Oh, yeah,
They
it's, don't take an animal down there, cause, oh, it's
Good
gross.
gravy. Go ahead.
Okay. Any other questions about? I-
No, you're doing
okay.
great, I'm
Okay.
not putting you on the hot seat, I mean, it's just, you know, we waste more money in this country than you can shake a stick at.
Well, the reason I brought DEC, remember when the, fire was in the silos over at Addis Company?
Yeah.
DEC had 3 air quality sensors over there, it was mainly done just to suffice the community.
That's all it was.
That's all it was, because like when the wind blew, it would change.
Oh,
You
yeah.
could smell it across the river, over here, the
Right.
traffic, it was just the thing to do.
Yeah,
Right.
It didn't prove anything.
Right, and I think they just wanna know with the wildfires, how far it's reaching, who's getting,
Yeah. It's just nice thing to do. That's basically.
hopefully it don't take too much of my staff's time, but I
hopefully
thought.
none.
Well, I think we have to do a little bit of the monitoring, we have to check it and report the data.
Mhm.
So now that it snowed 2 or 3 times in Canada, the fires aren't quite as bad as they were, that's when we get the equipment.
Yeah,
Yes. Definitely an afterthought. Preventive, during the month of October, we perform flu clinics almost daily, and we have received our first shipment of the Moderna COVID seasonal or monoclonal vaccine. Walk-in clinics will start for the Moderna vaccine next Monday and Friday, 9 to 11 and 1 to 3. We're also gonna be doing appointments on Tuesday, so if anybody wants to get their Moderna shot, please
Already have
come on down.
appointments on Tuesday?
Yeah, appointment on
Good. I've
Tuesday,
had several
walk in
people
on
ask.
Monday, Friday. And it is the Moderna. It's definitely more cost effective
got a question.
vaccine.
While you're on shots, I got a question.
Okay.
The news media, and whoever's paying for it, well, we're paying for it, let's be real, is pounding the devil out about shingle shots and us old people.
Mhm.
What's the health department's attachment to that? Cause there should be, if we're gonna have this,
It's very expensive and it doesn't have good shelf life. So that's why it's important that everyone get their shingle vaccine, but the pharmacies are better equipped to handle giving that, administering it.
I'd like to chime in on
Go
that,
ahead.
because my doctor said to me, that the success rate of the shingle shot is less than 5%, even though they're advertising that everybody should get it. Now, I don't know if that's true or not, and he has since retired, but that was his advice on the shingle shot, cause I asked him
yeah,
the same question, they're advertising the crap out of
they're
this.
pounding the living devil out of this on television.
Yeah, but, you
A lot of
know,
money in there.
they're selling your product, right? They're in the business of selling things. So, that's my thought, but I just wanted to throw that out there. My doctor said, you know, it's not worth the percentage that it offers protection on.
Hey, if Nate can get through it without having any crying, I think I could do it.
You can't even walk over here.
I can too. Those are just bad knees, come on, those are hockey.
Any other questions?
They got a shot for those too.
I know, they,
Yeah, that was fair, I mean, you know,
It
Who
is
killed
very
Kennedy?
expensive.
Who killed Kennedy?
Wow,
grassy
Any other
knoll.
questions? Might as well throw it out
Grassy
You're
there.
right.
There went that meeting.
You got another hour or two?
Wow.
You go
Yeah.
first.
okay, so we're gonna work to do a press release on the Moderna vaccine to go out sometime this week. We will be reaching out to the county buildings and offering to set up clinics also for any employees that would like the COVID vaccine. The cost is around $113 per dose, but there will be no out-of-pocket cost to anyone that has the participating insurance, which so far we've found that all insurance are participating, so that's a good thing. MCH, which is our maternal child health, is busy. We currently have 18 active cases and we have 11 pending referrals. Lead is also busy with 114 cases. Chronic disease surveillance, we've had 2 pertussis cases this year in October. That's the whooping cough. That's really bad for little ones. They were unrelated, which is good because it is very contagious. Both young children, and we found that they were both partially vaccinated, so that is usually the reason why we have cases. We're busy with other routine investigations. Healthy Families, Oswego County. I'm very proud to say that we are fully staffed, which is wonderful. Thank you all for bringing it back to the county. We currently have 31 families that we're working with. Children with special needs, we had 29 referrals in the month of October. Child Find opened 23 new cases, and our preschool children, preschool special education attended over 45 meetings with school districts. And that's my report.
Something I wanna point out, because it's, the conversation with opioids and everything tends to center, and one of the reasons why we started doing this is you and I had a discussion quite some time ago, and it was another committee I was on and you're on, that people weren't getting an accurate report, and as Vera said, there's still some more data they've gotta capture. The thing I wanna point out to you is that people that say, oh, well, we don't get anybody that really dies from this. Did you look at 2023 deaths so far? There's 26 in this county.
And that's accurate though.
That's accurate.
That's not a double count.
That's not a double count, but sometimes if they do an autopsy, it lags months.
Right, understood. Right, 'cause
So,
you can't tell until you
it's
do the
no
report back.
confirmed deaths, but we might get a straggler, 1 or 2
Understood.
for next month.
So it's important that you guys have that, because there's people questioning that going forward. Very good.
One quick question, I don't know if you can answer this or not, but you talked about how busy it was for the salmon season with doing inspections and things. Do you think the numbers were up this year for people up that way, or even, it seems like Oswego was?
Well, our food vendors were up, and everyone I talked to that lived in that area said it was like a normal salmon season,
Okay.
which is wonderful.
Yeah, we
That-
haven't been back to that point.
Right, exactly. I think COVID probably slowed everything down for a couple years, and now it seems like it's back to normal, which is nice to hear.
Anything else? Okay, I need a motion.
Motion adjourned.
Second.
All in favor?
Aye.
Aye.
Thank you very much.